What are the three structures located inside the carotid sheath? The internal jugular vein, the common carotid artery, and the vagus nerve are, remember, the mnemonic VAN. What is the spatial relationship among the three structures located inside the carotid sheath? The internal jugular vein is lateral, the common carotid artery is medial, and the vagus nerve is posterior. An enlarged left atrium can cause which non-cardiac symptoms? Dysphagia due to compression of the esophagus, and hoarseness due to compression of the recurrent laryngeal nerve. What is the most posterior part of the heart? The left atrium. Which coronary artery is most commonly occluded? The left anterior descending LAD artery, which supplies the interventricular septum. In what part of the cardiac cycle do the coronary arteries fill? Diastole. In most cases, the sinoatrial and atrioventricular nodes are supplied by which coronary artery? The right coronary artery. The right coronary artery supplies the posterior septum via which coronary artery? The posterior descending artery. If the right coronary artery supplies the inferior portion of the left ventricle via the posterior descending artery, is the heart right or left dominant? Right dominant. A patient has a myocardial infarction that damages the anterior interventricular septum and the apex. Which coronary artery was occluded? The left anterior descending artery. The posterior descending artery that supplies the posterior septum arises from the circumflex artery in blank, 20% to 50% at 80% of cases. %. This is a left dominant heart. Which coronary artery supplies the posterior left ventricle? Circumflex artery. Which coronary artery supplies the right ventricle? Acute marginal artery, from the right coronary artery.